Hello and welcome to this video. My name's Kris, I'm an Australian GP and welcome back to my Conditions 101 series. Today we're going to be diving into a very common condition known as a diverticular disease. You may have heard it as diverticulitis or diverticulosis, and they're under the same umbrella, but those two conditions are actually very, very different. If you're interested, keep watching. So this condition occurs in the large intestine. So we're talking about the gastrosystem, the bowels, all of that. The large intestine itself can change shape and size depending on what's going through it. Obviously, we're talking about fecal matter, but for several reasons, including having a low fiber diet, so having harder stools, bigger stools, or the bowel having to constrict more, it can have little outpouches, as you'll see in the diagrams I know editing Kris is going to put in. These are known as diverticulae, which is the plural word of diverticular, I suppose. So basically, outpouches. This just having the diverticulae is known as diverticulosis. So diverticulae, yep, you see the link there. And osis is really just the condition of. So this is one thing. It is when these outpouches become infected and or inflamed that it's known as diverticulitis. Think itis like appendicitis, like cholecystitis, which is gallbladder disease, cellulitis, infection of the skin. So diverticulae are the outpouches, and having them gives you diverticulosis or diverticular disease. And diverticulitis is the infection inflammation of said outpouches that we talked about before. Cool. So I kind of mentioned a couple of reasons they occur. So low fiber diets, constipation. But there are a couple of other reasons that one may be more prone to diverticulae. For example, ongoing use of anti-inflammatories, so non-steroidal anti-inflammatories, continuous use of steroids, being overweight or obese, being a smoker, and even your genetics. Having family members with the disease may make you more prone, as there is further evidence coming out that there is a genetic link. Right, so how do you know that you've got it? That's one of the good things about diverticulosis is it is a silent condition and it doesn't always give you strife. Sometimes we pick it up incidentally when we scan someone for another reason. However, diverticulitis itself is not a silent condition and you'll certainly know if you have it. So signs and symptoms of diverticulitis include fluctuations between constipation and diarrhea, abdominal pain, particularly in the lower left-hand side. So wherein lower right side pain is quite common for appendicitis, lower left is more common for diverticulitis, bloating, fever, nausea, and or vomiting are also very, very common signs and symptoms. So how do we find out if this is what's going on? Well, obviously we need to do a really good history, so chatting to you and finding out what's changed recently. Sometimes diverticular flares or diverticulitis can occur with no known trigger. However, especially in people who are known to have diverticulosis, so the outpouchings to begin with, changes in their diet such as becoming lower in fiber or eating a lot more nuts and seeds, which can get trapped in the pouches and cause an inflammatory response, can be a real key indicator that this is what's going on. Otherwise, a mainstay of diagnosis is using a CT of the abdomen, which can show us the outpouching and the inflammatory changes associated with diverticulitis. We can order blood tests as well to see if there's any other causes or complications of the diverticulitis. However, more often than not, the blood tests are used to track the inflammation and see that there is a resolution of it. Finally, we can do a colonoscopy, though it is strongly recommended that this does not occur during an acute infection. Okay, so I've told you you've got diverticular disease or diverticulosis. What does that mean you have to do now? As I've kind of alluded to a few times, it does come down to your diet and fiber and making sure that you are going to the toilet regularly with soft bowels, mind you. This prevents the transition to diverticulitis, the infected or the inflamed stage. And many people go on for years and years and years and never have an inflammatory issue. If you are diagnosed and have a diverticulitis, first off, I'm so sorry. I have been told it's absolutely awful. Because there is an infection, quite commonly we will treat with antibiotics because the infective process is almost always, I've never known it not to be, a bacteria. It will give you good pain relief. We can sometimes give you antispasmodic medications, which stops the bowel from spasming, as it sounds, which can be one of the causes of pain. But at the heart of it all, the mainstay of treatment is gut rest. So having a low residue diet, making sure your diet is more liquid than anything, and just slowly, gradually building back up to eating, starting with really bland foods, so nothing with too much spice, certainly nothing with seeds or nuts, and working your way up from there. At its very, very worst, at its very, very end stage of disease, we can treat diverticulitis with a colectomy, which is taking half your bowel out, or maybe even a total colectomy, taking the whole bowel out. So it really depends on how it affects you as to how we treat it. We do, of course, try and avoid surgery where possible, but if you're unable to eat much or the outpouching is so significant, it may be an option for you. But of course, if you're worried about this, please talk to your own doctor about it too. And that's it, guys. That is Diverticular Disease 101. As always, please like, leave a comment and subscribe if you haven't already. Let me know what you want to see next. And until next time, do stay safe, stay healthy, and I'll see you in a video very soon.